The CDC reports that the Omicron variant now accounts for an estimated 3% of COVID-19 cases here in the U.S. The agency says the new strain has been detected in more than 35 states and Washington, D.C. Preliminary evidence also suggests that Omicron is more transmissible than the Delta variant. However, the president's chief medical advisor, Dr. Anthony Fauci, says there's no need for an Omicron-specific booster at this time. He confirmed a third dose of Moderna or Pfizer can provide more protection than the usual two-dose regimen. Meanwhile, the Delta variant is once again prompting virus-related restrictions in parts of the nation and even forcing some schools to go back to remote learning. Nikki Battiste reports from New York City.
As businesses and colleges urgently implement plans to combat Omicron, Dr. Anthony Fauci says there is no need to develop a vaccine specific to Omicron because studies show a booster provides considerable protection.
Today, the White House made it clear to fight Omicron, Americans need a booster shot.
Our booster vaccine regimens work against Omicron. At this point, there is no need for a variant-specific booster.
Just 30% of fully vaccinated adults have a booster.
It is a necessity.
To emphasize the need for that extra shot, New Jersey declared today Booster Day, 1 year after the first vaccines were administered. Omicron is surging there and in New York, making up 13% of cases compared to 3% nationwide. The variant is now reported in 36 states, Washington, D.C., and Puerto Rico.
This is a roll of the dice. You don't know for sure that you're going to just slide right through it without any problem. We also know that prior infection with COVID is not holding up at all to Omicron.
As Omicron spreads nationwide, California is reinstating an indoor mask mandate regardless of vaccination status beginning today. And Philadelphia's health commissioner is urging residents to cancel holiday gatherings with friends and family. College campuses are cracking down too. Cornell University's campus is nearly fully vaccinated, but has an outbreak of more than 1,100 COVID cases, many likely from Omicron. NYU has canceled all in-person gatherings. Princeton has made all exams remote and encouraged students to travel home for the holidays as soon as possible.
What do you predict January might look like?
It's hard to imagine we wouldn't get to over 1 million new cases a day, which is a staggering number.
Tonight, Apple has temporarily closed stores in Miami and Annapolis, Maryland, because of the rise in COVID cases. Here in New York City, average daily cases in the past 2 weeks are up 109%, forcing some Broadway shows to shut down yet again. Lana?
Nikki, thank you. For more, I want to bring in Dr. Robert Rock. He's a family physician. Dr. Rock, thanks so much for being here. As we heard Nikki reporting, Cornell University found more than 1,000 Omicron infections discovered among those who recently received their booster shots. How concerning is that?
I think that it is concerning. We know that the vaccine isn't as effective against Omicron as it was against Delta, but specifically in terms of preventing infections. So although more people will likely get infections, we're not 100% sure how severe the infections will actually be, whether they'll need to be hospitalized or go to the ICU. So in order to be as cautious as possible, I think using all of the strategies and tools that we have to prevent infections is imperative. So social distancing, masking, getting tested is going to be imperative.
And the research is overwhelming on all of the various strains that if you're vaccinated and you do contract COVID, that it is a less severe infection. Dr. Rock, Dr. Anthony Fauci says that booster doses of Moderna and Pfizer are likely to offer, quote, substantial protection from Omicron. Tell us what's considered substantial.
So we're seeing that the protection from the first 2 doses of the mRNA vaccines to Omicron went from 70% protection to 30%. We're not 100% sure exactly where we'd end up in terms of what the booster will do, but we're thinking somewhere around the 50s or the 60s.
I want to ask you, Dr. Rock, because I have friends and family who received the Johnson & Johnson shot, and some of them are concerned about Omicron. What should they do? Because I know that this is a question that a lot of families are having across America.
Yes. The preliminary studies for the Johnson & Johnson vaccine are showing that the Omicron variant is getting around the antibody defenses that the Johnson & Johnson vaccine stimulates in people who have been vaccinated, which means that they'll be more likely to get infections. We are looking at studies from South Africa that say even for people who have gotten those infections, they're less severe than if they weren't vaccinated at all. And this is specifically with the Johnson & Johnson vaccine. So I would say my advice would be to do your due diligence in decreasing your risk of being infected, but I wouldn't have them panic in terms of thinking that the Johnson & Johnson vaccine isn't doing anything. Right now, we're still waiting to see what results come in terms of exactly what the Johnson & Johnson vaccine can do for protection from serious infection compared to the mRNA vaccines, but I don't think all hope is lost.
Okay, and that's also a good reminder, too, that mixing and matching is something that the medical community is behind if people are concerned about that. And there's some studies that also indicate that there might be better coverage that way. Dr. Rock, the CDC director expects that the number of Omicron cases to increase heading into the winter months. How are you preparing for this potential surge in infections and possibly hospitalizations, particularly among the unvaccinated?
So I'm telling my patients everything that I've been telling them in terms of doing all of the defensive measures that we know work. Social distancing, when that's not possible, masking, increasing the amount of ventilation in an area, and also being tested before you come into a gathering during the holiday season. I really think that people should think twice in terms of the loved ones who are at greatest risk, in terms of people with pre-existing conditions that we know have worse outcomes with COVID, to really think about whether or not coming into gatherings together is a good idea.
I also want to ask you about laboratory studies. There are several that suggest that T cells can offer vaccinated people protection against severe disease from Omicron. Help us understand the difference between T cells and antibodies.
So antibodies are your body's first line of defense. They're really put out into the bloodstream and neutralize the virus before it enters the cells of your body, which is how we understand the vaccines prevent COVID infection. Now, if that weren't to work, in the case of Omicron, where the surface of the virus is causing mutations that make these antibodies less effective in identifying and neutralizing the virus, the second line of defense are the T cells, which identify infected cells and neutralize and destroy them before they can further reproduce the virus to spread to other parts of the body. So we know that people with prior infections and people who've been vaccinated still have a good amount of T cell function that is helping to really make that difference between the infection rate and the rate of severe disease.
All right. All very interesting stuff. Obviously, we still don't know a lot about this emerging variant, but appreciate you helping to keep us informed about what we do know. Dr. Robert Rock, thank you for joining and for all that you do.
No problem. Have a good night.